Good to see y'all.
This is kind of personal for you.
Yeah.
Because you know all about this. So tell us your story.
Well, about 11, 12 years ago, I was diagnosed with moderate sleep apnea. I was not sleeping well, waking up a lot during the night.
Yeah.
Thought that it was just insomnia. Went to my primary care physician and said, let me have a drug to make me sleep better. And he said, well, before we do that, let's get a sleep study and see what's going on.
Yeah.
And turned out I had moderate sleep apnea. And he was the one that originally introduced me to oral appliance therapy to treat sleep apnea. He had heard about it as a sleep physician. And at that time, I really didn't know much about it. But,
Right. But you're a dentist, so
Right.
it's kind of a logical thing to look into, right?
Right. So I did, was very intrigued by the whole area of dentistry.
Yeah.
And have since then gone through the whole process of becoming fully board certified in what we call dental sleep medicine,
Okay.
which is an area of dentistry that uses oral appliances to treat disordered breathing, sleep disordered breathing.
So could this work for anyone who now needs a CPAP, or is it best for a certain population?
Well, you've got to have enough teeth to support the appliance,
Okay.
because all the appliances are on the teeth.
Okay.
So
It looks like a retainer.
looks like maybe a football mouth guard
Yes,
Yeah,
it does.
yeah.
size
Yeah.
type of an appliance,
Yeah.
but it attaches to the teeth. So we've got to
Okay.
have enough teeth. We've got to have healthy teeth to support the appliance.
Okay.
And generally, we have to have enough movement of the lower jaw from all the way back to forward like a bulldog.
Okay.
Because what we do with oral appliances is we do bring the lower jaw forward just a little bit, but the primary function of the oral appliance is to stabilize that lower jaw.
So that it doesn't
so it doesn't
slip
drop back. Yeah.
and that closes the airways, I assume?
I always show this to my patients. So what happens when we sleep, the tongue, which is attached to the lower jaw,
Oh, sure.
and all the tissues attached drop back and obstruct that airway.
Gotcha.
CPAP blows pressurized room air to blow open that airway like blowing up a deflated balloon.
So this just keeps the lower jaw forward.
What we're trying to do is bring the lower jaw forward and stabilize it so that
Gotcha.
it doesn't drop back. So an oral appliance is trying to prevent the blockage from occurring
Right, right.
to begin with.
Makes sense.
Yeah.
So would this be almost like a permanent solution, or how do you perceive it?
Well, sleep apnea is a chronic, progressive, potentially fatal disorder, breathing disorder. Probably the most famous person in this area of the country, Reggie White, had been diagnosed with severe sleep apnea and was not wearing a CPAP and died in the middle of the night of a massive heart attack, which is what happens to people who succumb to.
So they don't suffocate, but that chronic loss of oxygen to
Puts
the
a
heart.
lot of stress. You know, when
Gotcha.
you're suffocating all night long, repeatedly over and over again,
Gotcha.
puts a lot of stress on the cardiovascular.
Very
didn't
quickly
know
here,
that
doctor, when do we
contributed
know
to
it's
that.
time to get checked out for something like this? I mean,
Well-
whether you have a spouse or a loved one, or if you live alone.
If you have a bed partner that notices you're struggling to breathe at night, that's a very good indication. If you live alone and are not sleeping well, are very tired during the day, excessive daytime sleepiness, if you just don't feel like you're functioning well, if you've gained weight, if you've gotten older, and you're not sleeping well, then it should be something you discuss with your primary care physician.
Okay.